Today we're going to talk about Achilles tendinitis. Achilles tendinitis is a very common injury we see with a lot of our athletes and also a very common source of heel pain for a lot of patients. It can be a very frustrating injury. Sometimes this injury can last 6 months, sometimes up to a year. So that's why we want to take the time to talk about some different causes, some of the signs and symptoms, and some different treatment options so we can get you back to your activities as soon as possible.
So with Achilles tendinitis, the most common cause for it is a activity or a change in load that your body is not prepared for. So to break that down, we're going to look at a beginner runner and someone who's new to running, that if they're doing too much volume, too much intensity right out of the gate, they're likely going to end up with an overuse injury to their calf and their Achilles tendon, causing heel pain. Now, the flip side to that, an elite runner or someone who's been doing it for a long period of time, they are also susceptible to having this condition pop up if they have any drastic changes to their training. So if they introduce too much speed work, too much hill training that their body is not prepared for, that they are going to be susceptible to this type of heel pain.
With Achilles tendinitis, there are two major types. There's insertional tendinitis, and that's right about here. The Achilles comes down from the calf and inserts into this bone here called your calcaneus. So with people with insertional tendinitis, they get pain right off of the heel bone here and at the very bottom of the tendon. Another type is called non-insertional tendinitis. So that's above where it inserts, 2 to 6 centimeters, usually about in this region is the most common spot. So when we press in here, we'll get pain. Sometimes there'll be a little bit of a nodule. Other times you can have some swelling around that area, around the tendon or down through the heel. Typically it's pain through the tendon. Sometimes there'll be tightness or pain elicited when we press through this part of the calf or higher up. This muscle here is your gastrocnemius. Very common to have a lot of tightness here, being some of your first warning signs that tendinitis could be developing. Below the gastrocnemius here is your soleus muscle. That's another common spot for tightness, especially in runners when they're first starting out. So again, if you start feeling chronic tightness through here, it could be a warning sign that eventually you're going to have some tendinitis lower down. When we're doing the exam, another thing we'll look at is just foot alignment, see if there's any major abnormalities that are contributing to it. In kids, one of the things to be careful of is it might not be tendinitis, it could be another problem with the growth plate on the heel bone here. That's called Sever's disease. So when we're doing that exam, if we squeeze the heel this way and it causes pain, that could be a sign that Sever's disease is happening and not a tendinitis. Okay, we're going to go through some common exam procedures that we do to kind of look at function of the foot and lower leg to see how that might be contributing to Achilles tendinitis. So we're going to first have the patient stand on his toes. So just checking that to see if there's pain. Some pain is okay, but if it's more than about a 3 out of 10, we're going to be concerned about that. From here, we're going to now have him walk forward on his tiptoes. We're going to look again for pain, see if his heel height decreases. And we're going to do that in one direction, turn around, come back. Again, looking for pain, any sort of limping. Now we're going to have him come back and stand here on the mat. And one of the common things we'll see is lack of big toe extension. So the ability to extend the big toe could be important for gait mechanics. So we're going to look at that side to side by lifting the toe here. In this position, should be getting about 40 degrees range of motion. And you see here, this one's limited. We're going to check that side to side. They're similarly limited, so neither one is getting to 40 degrees. So we want to look at total range of motion as well as differences, asymmetries side to side to see if there's anything that could be coming from the toe contributing to the Achilles pain. Next, we're going to get into looking at the arch. So in this position, we're looking for arch flexibility. And I'm going to have him turn and face the camera here. And with his feet planted, we're going to rotate through the trunk to the right and left. And when you rotate to the right there, you'll see the right foot elevate through the arch, which is normal. As you go to the left, the right foot pronates down towards the ground. So that's normal. He has fairly good range of motion there. Next test we'll look at is just single leg balance. So just standing on one foot with the eyes open and then with the eyes closed, and see if there's any asymmetries. He should be able to hold for about 10 seconds and looks pretty good. And we would switch to the other side, and again, just looking at side-to-side comparisons. So again, the foot's working, eyes be closed, should be holding for 10 seconds. And that looks good. So now we're going to move on to some different positions on the ground. So we're going to get into hands and knees. And then in this position, you're going to have the patient sit back onto their heels. And if you come look around from this angle at his feet, we want to see that all the toe joints are down on the ground and that the foot isn't coming angled side to side in any direction. So here, this toe joint isn't completely on the ground. And we saw in the other tests his big toe range of motion was a little bit limited, so that could be contributing from some tightness in the foot, which could have an effect on the Achilles. In this position, now I'm gonna have him go into a plank, so we're gonna go to the top of a push-up position. So when you're in this position, your foot should be strongly connected to the ground. So one way to test that is to try to pull up and don't let me lift your foot. So this is called rooting. So that's a good way to test to see if the foot is engaged in a strong position. Additionally, from here now, we're gonna have him stand and look at some strength and capacity of his Achilles and calf. So we're gonna move over to the rack here and hold on to the bar. So you're gonna use some support, and we're gonna have him do a heel raise. So go up onto your toes. And from here, we're gonna look at the height. And this should be our basis for now looking at the single leg. So we're gonna move to a single leg, try to go to the same height, and we're gonna have him go as many reps as he can. There's normative values for each age group. So depending on their age, we wanna see where they fit into that norm. Again, looking for any pain. Also wanna make sure that they're pushing through their big toe joint as they're doing this. So we do on one side until he can't do any more, or he can't reach the height that he got with 2 legs, and then we would do the other side. So these are some of the basic functional tests we'll do. Sometimes we'll look at some other areas. We always want to baseline our patients and our athletes. So depending on his demands of his sport, we might be doing different tests. This is a good example of some of the basic things we'll look at with the lower leg and foot for Achilles injuries. One of the first treatments we often do is called active release technique. Active release technique and Graston technique are both forms of treatment that apply a deep pressure through the tendon and muscle. And there's research that supports their use to help encourage pain reduction as well as blood flow to the area to encourage tendon healing. So with ART, we're going to start doing a treatment right along the tendon here. With the tendon, as we discussed before, a very common site at the mid part of the tendon for tendinitis to occur. That occurs partly because there's poor blood flow in the tendon. With this treatment, we're trying to restore some of that blood flow and break down any tightness. I'm going to work it on both sides now and have the patient bring his foot up towards the shin. That's going to create an active motion while I'm giving some pressure. With these treatments, a lot of times there is some pain. It's usually a good pain. Patients will say it hurts, but it's a good hurt. A lot of times after the Achilles treatment, we'll move up into the calf and do some treatment there with any tight muscles or painful spots. So I'll feel around, see if I feel any spots. A lot of times this inner spot of the calf could be a good one. So I'm going to press in here, and the same thing. We're going to have the patient start here and then stretch their foot down and give a little extra pressure. So this is treating the inside of the gastrocnemius, the medial gastrocnemius. Another spot is sometimes through the soleus, so we can work it a little lower here. And again, provide deep pressure and then stretching the muscle out. As I mentioned, in addition to ART, we also use a technique called Graston technique. So that uses a metal instrument here to provide friction massage along the tendon and the muscles. We use a little bit of lotion and we'll massage up and down through the tendon. Sometimes you'll see little red dots develop, a little bit of redness. That's very common. Again, we're trying to bring blood to the area to encourage healing. Sometimes there'll be soreness after treatment for a day or two. That's normal. We need the body to respond to create a response that will strengthen the tendon back up. We want to keep in mind with all of these therapies, we want to do pain relief with the ultimate goal of loading the tendon through exercise to really help build it back up and prepare you for the exercise and activities you want to return to. We hope you learned something about Achilles tendinitis today. If you have any questions about it, please leave it down in the comments and we'll get back to you.
And we will be going over a more specific video on how to load the Achilles tendon and common exercises we give patients who come in with this condition. So please remember to subscribe, like this video, and we'll see you on the next video.